So my topic will be diabetes in sepsis, implication for clinical care management.
Diabetic sepsis.
Yeah, ma'am. So it is a retrospective cohort study which is have aim to investigate the impact of comorbid diabetes on the prognosis of patient with sepsis in ICUs. So there will be outcome of in term of the mortality, length of stay, and complication. So I included that it is a retrospective, more than 18 years patient, which admitted in the Apollo Sage Hospital, and it defined as the sepsis is defined as the sepsis three criteria, which has the SOFA score of more than 2, and duration of the study is the 18 month from Feb 2023 to August 24. And we exclude that pregnant patient who have incomplete or unavailable medical record, and individual with pre-existing terminal illnesses. So total number of patients is 996. Out of that, 502 patients are identified as a diabetic patient and 494 patients without diabetes. And this is the statistical analysis. We have chosen the SPSS version 25, and this is the observational data. So first primary outcome was the mortality, and definitely there is a p-value reduced, low p-value. That means the diabetes has impact on the mortality as well as longevity of that stay. The length of stay, mechanical ventilation, dialysis days, secondary infection, ventilator associated pneumonia and bloodstream infection, and duration of the vasopressor are more in the diabetic group as compared to the non-diabetic groups. And these are the significant. When we do the subgroup analysis with the glycemic control in terms of the type 1 diabetes and type 2 diabetes, and HbA1c, if patient has the HbA1c less than 7, the mortality is 22%. If HbA1c goes up to 7.9%, the mortality in those groups is 28%. If the patient has uncontrolled diabetes prior to the admission, the mortality is 35%. And definitely type 1 or type, and compared to type 2 diabetic, type 1 diabetics have the more length of stay in ICU as well as the more chance of the secondary infection also. But there is some important thing that this is the large sample size which enhance the statistical power and generality, but there is some bias also because this is a single center study, and which limit the external validity. So my conclusion is the significant association between diabetes and worse outcome in ICU patient with sepsis. And diabetes was linked to the increased mortality, longer ICU stays, greater dependence on the mechanical ventilation and vasopressor, and higher rates of the secondary infection. Poor glycemic control indicated by HbA1c more than 9% was associated with the highest mortality in long ICU stays, underscoring the critical role of the hyperglycemia in exacerbating sepsis outcome. And type 1 diabetes patients experience worse outcome than those with the type 2 diabetes. And the findings emphasize that impaired immune response, chronic inflammation, and metabolic dysregulation characteristic of diabetes significantly worsen the prognosis in sepsis. These mechanisms, coupled with the high prevalence of the diabetes among ICU patients, necessitate a focus on tailored strategy for glycemic control and the management.